Hi, my name is Jo Keegan, physiotherapist. Welcome to Loughborough University Sports Injuries Clinic. Today I'm going to be showing you how to assess and treat and manage hamstring injuries. Hamstring injuries are very common injuries that we see in the clinic and usually associated with sports that involve a lot of sprinting and running, so hockey, rugby, football and track and field. The athlete normally complains of a sudden sharp pain at the back of the thigh that usually means they have to stop the activity immediately. Pain is usually felt when we palpate the muscle, when we press the muscle, when we stretch the muscle and when we get the muscle to contract. Hamstrings are muscles that attach on the ischial tuberosity of the pelvis and then fan out down the back of the leg and attach just below the knee joint. So what we'll do, we'll demonstrate a straight leg raise, we'll measure her muscle length and we'll measure her muscle power to demonstrate those tests. Okay, so we're going to assess Lauren's hamstring, see whether there's been any muscle damage, and the way we're going to do that is just to measure the power in the muscle. So we're going to ask Lauren to bring the knee up a little way, and Lauren, if you can just pull your heel in towards my hand, and we'll see if that reproduces any pain. Off you go. So heel up, and then relax. Does that bring on any discomfort? No. Lovely, and then relax down. So we've assessed Lauren's hamstring strength. We now need to see whether the muscle has been shortened by the injury. A classic feature of a hamstring tear or sprain is that the muscle loses its flexibility. So the way we look at that is to perform a straight leg raise. And we're assessing to see whether that brings on any of Lauren's pain or whether the muscle is tight. So we'll compare that to the opposite side. Does that bring on any pain? Good. Okay, so we've determined that Lauren's hamstring is recovering well. There's no pain on straight leg raise and she can perform the muscle tests on the bed comfortably. So now we need to consider whether Lauren's hamstring is actually ready for her to go and start doing some training. So we've got a couple of strength tests that we're going to perform now to determine whether she's ready to start doing some running. Okay, we're going to ask Lauren to perform a very simple bridging activity, which basically makes the hamstring, makes the glutes work quite hard to see whether the muscle's ready for some more rehabilitation. So Lauren's going to place her feet on top of the box. That's it. And then she's going to dig her feet into the box and lift her pelvis up off the floor. Off you go. Good. And then down again. Well done. Okay, and again. And down again. We're looking to see whether she can perform the movement and whether she can perform the movement without any pain. If she can do that, then we'd move on to the injured leg only. So if you lift the one foot off, an injured leg is on top of the box and bridge up again. Good, and down again, and again. Lovely, well done. And again, we're looking for form, technique, can she perform the movement correctly, and does it bring on any hamstring pain? We would need her to be able to perform 3 sets of 20 comfortably before we decide that she's ready to start doing some training again on her feet. Okay, we're going to assess Lauren's hamstring in a more functional position now in standing. So we're assuming that she can do the bridging activities without any pain, so we're going to move up to this position. What I'm going to ask Lauren to do is basically bring the injured heel or the injured leg up towards the bottom, so with a kind of a heel flick type movement against some resistance of the TheraBand. So if you can do that, Lauren, for us, just bringing the heel up and then back down again, lovely, and again, good, and back down again. If you could do that a little more quickly as well. Good, and down. Okay, flick, and down. And again, we'd ask her to perform 2 or 3 sets of 20 to see whether that reproduces any of her pain. We're working in the muscles fairly inner range, mid to inner range, which shouldn't bother the hamstring too much at this stage. We can then progress it on into outer range, which challenges the hamstrings a little bit further. So Lauren, what we're going to get you to do is just start to extend the stride out, using the arms as well with a particular exercise. So bringing the knee up, good, and through, good. Kicking the heel out behind you, good, and back up, good. Good. So it's reproducing the running action here. If you do a few more for us there, good. Does it make the hamstring sore doing this? And again, we ask her to do 2 or 3 sets of 20. And if she can perform these comfortably, we then start her doing some running on the track. Okay, so key points. If you've been running, training, playing in a match, and you feel a sudden sharp pain in the back of the thigh, it may well be that you either strained your hamstring or torn it. You need to have a period of rest And if the hamstring is weak, if you've lost your flexibility in your hamstring, then you need to have a period of rest and rehabilitation. If when performing the muscle tests that we've shown you today, if the hamstring is still a problem, then you may need to come into the clinic for further assessment and treatment. Thank you for listening today. There'll be more videos to come from the Loughborough University Sports Injuries Clinic. I've been Jo Keegan.